All right, so just first question. If you could take me back to like when vaccines first came out in the area, what was your reaction as far as you could tell from people who were coming to get them?
You mean the COVID vaccines?
Yeah, the COVID vaccines.
Right, because vaccines came out 100 years back. So,
Yeah.
so yeah, we had patients really asking us for quite a long time before we started vaccinating patients and our employees. So I would say probably 2 to 3 months before vaccines were formally approved, we had a lot of questions and a lot of demand from the patients. They wanted to get it as soon as possible, and especially the 65 plus. And I think for a good reason, that was also the CDC and FDA approval initially for the vaccines, anyways. And we achieved a very high success rate of vaccination in that age group. We had right off the bat around 81% were vaccinated, even in the first go around. I think in that age group, patients realized the significance of it. They had seen the significant effect on the life and mortality and morbidity. So I think it was more, I wouldn't even say faith. I think that they believed the evidence behind at that time for the vaccinations, and they were very willing to get it as soon as that's available.
And then so right now the vaccine rate in Yuma County is around like 66%. Now, being at this point in time, several months after, is that about where you expect it to be? Is that above, below your expectations?
Actually, that's right where we had projected. Now 66% for single shots, and right around 60 plus for double, for total vaccinations. Because we knew, once the elderly are vaccinated, and the ones who have significant health conditions are vaccinated, it will slow down. Now you have to realize that vaccines are still not approved for less than 12. So that, you could say another 25,000 which are not even eligible for vaccinations. So if you talk about the percentage in who are eligible at this point of time, it's higher, right? It's close to I would say 78 to 80%. Now that age group is going to be approved for vaccinations over the next 2 weeks, and that point obviously the eligible population will increase. And when that happens, there will be parents who would want to vaccinate their children for a very good reason. They have been vaccinating their children for 7 diseases for the past 3 decades, right? I mean, we save close to 3 million lives a year just because of that, close to 15 million infections a year because of that vaccination. So I'm sure there will be, a lot more parents who will, want to protect their kids and will take that step. So our percentage will jump even further at that point.
All right, and then so the main focus of this story is focusing on people who have been hesitant to get the vaccine and why some people have decided to get it now as opposed to when it first came out. So initially, why do you think people have been hesitant to try and get it?
Vaccine hesitancy is not new. I think it has been there since the dawn of vaccinations, I would put it this way. And for, again, that's the I would say human condition is to be concerned about something which is quote unquote can be considered artificial, right? I mean, this is the evidence in support of vaccination's benefit is stronger than ever. Smallpox eradicated initially, and recently polio eradicated around the world. One of the major contributors to the lifespan, we have doubled our lifespan in less than 100 years, is vaccinations. And parents very willingly vaccinate their kids for those diseases in the childhood. So I think if we look at holistically about, for the vaccines, there are only, I would say, marginal concerns. COVID specifically has caused a little more misinformation out, a lot of questions raised, despite, close to 210 million people in the United States, and with a significant improvement our mortality, especially in the ones who are vulnerable to the bad effects of the COVID vaccine. So I think we got to put it in that perspective. We knew never there will be 100% of uptake on the vaccine, any vaccine. But I think personal stories matter a lot. When they see a loved one or a friend who has suffered a lot, that may motivate people quite a bit more. How much that is effective. I think for healthcare workers, for us, it's extremely painful and traumatic to see somebody asking for a vaccine on the deathbed, literally, because they could have survived before if they had a vaccine. So that is what's really impacting the physicians and healthcare workers the most, because we see that impact, which is not visible to the community outside. This is we still hope that people will continue to get motivated to get vaccine as the time goes by. As more and more people get it, I think the confidence will rise in its efficacy. As I've said many times before, COVID is here to stay. COVID is not going to go away. It will be a year of soft infections, and then next year of more infections. It has become an endemic, which means it's going to be in the community, in the population, at a low rate at all times. You will just have exacerbation every now and then. And as the time goes by, I think people will be more confident in getting it. The other question, and with a lot here, that I had COVID, I don't need it. We know for a fact that as it stands for flu, the normal immunity does not last that long. And, now we have evidence of benefit of vaccine even in people who had COVID infection. So it's in fact, vaccines give protection which is as or stronger than natural infection, and it's reliable. It lasts longer. So just because somebody has COVID infection last year does not mean that they're going to be protected at this point of time or in the near future.
Okay, and then do you feel like there will be, I know booster shots are beginning to roll out, that's starting to become a point of conversation. Do you feel like there'll be any hesitancy there as well, even from people who have already gotten the vaccine, that maybe they'll be a little on the fence about getting another one?
Oh, I've seen otherwise. I've seen especially the ones who have received the primary series. I'm getting messages, almost, a couple hundred a day messages right now from all the patients in the community, who wanted to know when we will launch the boosters. Now, our primary goal is to protect the healthcare workers first, so that we have people who can, provide services when we need. So at this point, our goal is to launch it for employees. The good thing is the vaccination available in the community, entire community, almost all pharmacies are giving vaccines right now. So if if anybody needs a booster and with current qualifications, they are able to get it. So there is no issue getting it. But our main goal is, as soon as the CDC approves this week, we will launch the booster shots for our employees.
Okay, and that's pretty much all my questions. Is there anything that you feel that I missed or that you also wanted to touch on?
No, I mean, I was reading the stats just before this interview. We save a lot of children every year. Close to 3 million lives are saved with our current vaccinations. Childhood vaccination, I would say. And I was surprised to realize that it's still, we have a capability of saving another 33,000 lives. Another 10 million plus infections. There are still hesitancy on childhood vaccinations, and which could be, especially in some of those meningitis and other risk factors are very, very serious conditions. So we hope that parents do the right thing for their children, and people do the right things for their loved ones and the community.